It's my great honor to stand here to talk about our study about CD22 CAR T immunotherapy. My title today is "A New Anti-CD22 CAR T immunotherapy saved the life of children with leukemia." I'm from Beijing Boren Hospital in China. So I have nothing to disclose.
But you have to wait for another 5 seconds.
Okay. It's a long time.
Yes.
Okay, move on. Acute lymphoblastic leukemia is a fatal blood cell tumor. And it is usually treated by chemotherapy and allogeneic hematopoietic stem cell transplantation. In recent studies, CD19 CAR T immunotherapy have been successfully used in treating refractory or relapsed acute lymphoblastic leukemia. However, some patients have still relapsed, and usually they were resistant to a secondary CAR T-cell infusion. So our purpose is to explore a humanized CD22 CAR T immunotherapy in pediatric refractory or relapsed acute lymphoblastic leukemia. So we have 15 patients in our study. All of them are children, and all children are refractory to chemotherapy. And 14 children had relapse or no response to previous CD19 CAR T-cell immunotherapy. And 4 children had relapse after allogeneic hematopoietic stem cell transplantation. So in our study, all heavily treated kids with refractory or relapsed BAL will die with current therapies. So here is our protocol. First, we get CAR vector from Shanghai Yake Biotechnology Company, and we connect patients' lymphocytes from their peripheral blood. We do the CAR vector transfection and CAR T expansion in vitro. After about 1 week for cell culture, we get CD22 CAR T-cells. So we infuse the CAR T-cells into patients, and after that, we monitor and treat the side effects. The major side effect is the cytokine release syndrome. And after that, we do the evaluation on therapeutic efficacy. So the cell culture and the clinical use are both in our hospital. Here is our results. First, we get high efficacy in our study. The complete remission rate is 18%, and partial remission rate is 6.7%. So the overall response rate is 86.7%. We also evaluate the long-term outcome. We had 13 response cases, and we had progression-free survival rate is 91.7%. On the other hand, we think this therapy is quite safe. This picture showed major side effects, cytokine release syndrome in all patients. We find no mild CRS in all patients, and nobody died from our study. And we can see the neurotoxicity, and there's no severe neurotoxicity has been observed. And we found no difference between the non-HCT patients and HCT patients in CRS. So here is our conclusions. CD22 CAR T immunotherapy brings a hope for patients with refractory or relapsed BAL who even fail to CD19 CAR T immunotherapy. And we think it's quite safe. No children die, and no children had severe side effect during the study, and even if post-HCT patients. So if anyone wants to know the details of our study, welcome to our presentation. Thank you.